Let's get started.
Now, even though you may know some or even a lot of this, let's start with some basics, just so we're on the same page. All right, let's quickly review the pregnant body and where your baby grows during pregnancy. Now, your baby may be a boy or a girl, but just to make things easy, I'll call him a he. I'll also go ahead and refer to your doctor as a she, even though your doctor might be male. Okay, the uterus or womb is where your baby grows. And the placenta brings him food and oxygen through the umbilical cord. Now, while we're talking about the body, I just want to point out something else you need to know about.
Your pancreas. Your pancreas is part of your digestive system and helps break down food.
It also makes a hormone called insulin, which I'll talk about in a moment. Now, to get an idea of how the pancreas usually works, let's go over how things work in a body that's not pregnant. When everything's working the way it should, your body breaks down food into a few different things, including glucose, which is a kind of sugar, so that's what I'll call it. This sugar flows into your bloodstream. Now, your body can't turn sugar into energy unless it gets into the cells, but it can't get in without a key. So think of insulin as the key. As I mentioned before, insulin is made in the pancreas, which is a long, thin organ. And insulin unlocks the cells and lets the sugar in. This way the sugar can leave the bloodstream. But without insulin, the sugar is locked out. It just stays in the bloodstream and causes problems. So getting insulin is very important. Now, pregnancy changes the way your body breaks down sugar. Okay, let me explain. In all pregnant women, the placenta makes its own hormones. These hormones typically make it harder for the body to use insulin and sometimes block the way insulin normally works. This can cause something called insulin resistance. Just like it sounds, it's when your body doesn't accept or use the insulin it's making. Because of that, the pancreas makes more insulin, which usually isn't a problem. If needed, it can even make up to 3 times more insulin than usual, but sometimes that's still not enough to get the sugar into the cells. And that's when gestational diabetes shows up. With gestational diabetes, you have more sugar in your blood and not enough sugar getting into your cells. Not good. Your body doesn't get the energy you need from the food you're eating. And the extra sugar makes its way through the placenta to the baby. So what's the problem with your baby getting some extra sugar? Well, a lot of things. For starters, he'll have higher sugar levels. And those higher sugar levels will cause his pancreas to make more insulin than usual to keep up. When that happens, his body will end up storing the energy as fat, making him larger than normal. This is called macrosomia, or large baby. We'll go into more detail about that a little later. Right now, you may be worried and wondering, how long have I had this? So let's talk about that. Well, the good news is you probably haven't had this for very long. Gestational diabetes usually doesn't appear until late in the 2nd or early in the 3rd trimester. First of all, it takes a while for the insulin resistance to affect your body enough for it to become a problem. In fact, that's why most doctors usually don't test for gestational diabetes until somewhere between your 24th and 28th week of pregnancy. Secondly, there are no signs you could have been looking for. There's really no way of spotting it other than the sugar or glucose test your doctor gave you. Okay, well, then why me, right? Well, gestational diabetes can happen for many reasons, including if you've had it before. There's a history of any kind of diabetes in your family. Your doctor has told you you have something called prediabetes. You had a baby before that weighed more than 9 pounds at birth. You were already overweight before you got pregnant, or if you became overweight during pregnancy. You take a steroid medication like prednisone. You are more than 25 years old, and unfortunately, the older you are, the higher your risk is. Or if you have something called polycystic ovarian syndrome. And if you have this, you know what I'm talking about. Now, I know that's a lot. And you may fit into one, many, or none of these categories. But the main thing is, you're not alone. A lot of women develop gestational diabetes. And this is something doctors know how to treat and is, in fact, treatable. Your whole healthcare team will help you and your baby through this. Now, I'm sure by this point you're thinking, that's all good to know, but what will gestational diabetes mean for me and my baby? The most important thing you need to know about gestational diabetes is it's a treatable condition that you have some real control over. So we'll talk about how you can do this. But first, there are some risks you need to know about so you can keep an eye out for them. Something we've already discussed is higher blood sugar. Again, this means that the sugar from the food you eat is staying in your blood, and your body is not getting the energy it needs. And as you know, you need every bit of energy you can get, both for you and your baby. You're also at risk for a pregnancy condition called preeclampsia. You may have heard of this before, but what exactly does it mean? Well, preeclampsia is an issue where the smaller blood vessels get kind of leaky. As you can probably guess, that can cause some pretty serious problems, like high blood pressure. And it's important to know you're also more likely to get type 2 diabetes sometime after your pregnancy. About 1 in 2 women who have gestational diabetes go on to develop type 2 diabetes. Yep, around half. And as you also may have heard, type 2 diabetes can have some major long-term consequences. So we'll talk about what you can do to delay this or even prevent it a little later. Now, what about your baby? One of the major issues that we talked about earlier is having a large baby, or what's called macrosomia. It doesn't sound so bad, just a bigger baby, right? Well, unfortunately, it can cause some serious problems. The main concern with a large baby is that during delivery, his head will come out, but his shoulders will get stuck. This is called shoulder dystocia, and it could lead to serious problems for mom and baby. When this happens, it's usually because the extra weight typically goes to the upper part of his body. So when he tries to make his way through the birth canal, sometimes his head can get out, but his shoulders are too big and can't get through. With shoulder dystocia, the baby can have a broken arm or a collarbone or even a nerve injury. So if you have a large baby, which means about 9 pounds or more, your provider may suggest a C-section to avoid this problem. Now, after your baby is born, gestational diabetes can also cause him to have low blood sugar, which doctors call hypoglycemia, but which most people just call a low. Let me explain. When gestational diabetes goes untreated, the baby gets lots of extra sugar from across the placenta. This means he's getting bigger, but it also means he's getting used to having a lot of sugar in his blood. So his pancreas makes more insulin to keep up with the extra sugar he's getting. When he's born, his pancreas keeps on making the same amount of insulin to keep up with that same amount of extra sugar. But the problem is, now there's only his own sugar, and that's a lot less than before. And that's when a low can happen. With a low, the extra amount of insulin his body makes brings the levels of sugar in his blood way too far down. These low sugar levels then slow down some of his body's functions. This can last for a few days after birth and is obviously very serious. In rare cases, it can even lead to a coma where the baby becomes unconscious and doesn't respond. He can also have problems like too much amniotic fluid, the liquid surrounding your baby, in the womb, or jaundice, which is when his skin turns yellow after he's born. He might also be at risk for respiratory distress syndrome or breathing problems from lungs that didn't fully develop, but this usually only happens with the delivery before 39 weeks. Now, not treating your gestational diabetes can also increase risks for your child as he grows. He's more likely to be very overweight, and he's more likely to develop diabetes himself. And while this next risk will be especially hard to hear, I want you to have all the facts. If it goes untreated, gestational diabetes can also increase the risk of a stillbirth, which is when the baby isn't alive when he's born. Now, I know that's hard to hear, and I'm sure you wish you didn't have to deal with it. But these are the worst case scenarios. And you are going to have a lot of help from your healthcare team who know how to take care of you and your baby. And best of all, there are a few simple things you can do to keep you and your baby healthy. And that's what I'll talk about next. Now, you've just heard a lot of important information, and I have some more coming up. But keep in mind that you'll have the support of your whole healthcare team. And their main goal is to keep you and your baby healthy during and after your pregnancy. So if you ever have any questions for them about anything, give them a call. That's what they're there for. And just so you know who they are, your team may include an obstetrician. You probably call her your OBGYN. Or a pregnancy specialist called a maternal fetal medicine physician or perinatologist. You might also have a dietitian or a registered nurse who will probably also be a certified diabetes educator. Or you might have an endocrinologist, a doctor that specializes in diabetes, on your team. These specialists are usually in charge of your nutrition and monitoring your blood sugar. And if you need medication, one of these people will prescribe and monitor it for you. Okay, so now you know what gestational diabetes is, why it's important to treat it, and who's involved. So, how do you take care of it and prevent some of those possible problems? Well, the good news is, it's really pretty simple. There are only a few things you need to do. Let's start with blood sugar monitoring. Since you can't feel if your sugar is high, daily blood sugar monitoring is the best way to keep track of it. And if your sugar levels are good, your baby's levels are good too. So you want to make sure you follow whatever instructions your healthcare provider gives you on how and when to test your levels. The most common way is to test with a home blood sugar meter. It's really easy to use and it's pretty painless. Your healthcare provider will show you exactly how to use it and what your target sugar levels should be. But the basic idea is you stick your finger with a device called a lancet, which is kind of like a short needle. Then you get a drop of blood to put on a test strip. And a machine gives you a number that tells you how much sugar is in your blood. You might be thinking, yikes, a needle? But don't worry, it's really short and quick. Your provider will probably have you check your levels when you first wake up and 1 or 2 hours after every meal. But, of course, she'll let you know exactly when you should test yourself. And once she gives you a schedule, stick to it. Unfortunately, levels measured at different or incorrect times just aren't as useful. Now, your meter might keep track of your readings, but even if it does, it's important to keep a journal and write them down, along with what you eat and any physical activity. Recording your levels lets you and your provider see how they change with diet, medication, and activity. In fact, your provider may have you write down your numbers on a sheet and fax them in about once a week so she can review them. Or she may ask you to bring them to your appointments. Either way, make sure you're keeping a record of everything she asks you to track. Now, in addition to daily blood sugar testing, you'll get a meal plan that's made especially for your condition. This is the easiest and best way to control your sugar. In fact, many women are actually able to control their sugar and their baby's sugar through diet and exercise alone. While your exact nutrition will be laid out by your provider, there are a few things you can probably plan on. It will be well balanced and healthy. That can mean a lower fat or lower carbohydrate diet, but your provider will tell you what balanced means for you. For example, she may tell you to eat 3 meals and 3 snacks a day, and she'll let you know when you should eat these. You'll need to avoid sweets and foods high in sugar. It's really important to make sure you're not taking in anything extra that isn't recommended for you. Now, you might want to know what foods are high in sugar. Well, some things you can probably guess, like candy and regular soda. But others, like fruit juice and things like barbecue sauce, bottled tea, and granola bars, might surprise you. So be sure to go over what foods to avoid. Your team will be able to look at what you eat now and figure this out with you. And I know this can be hard with any cravings you might have. But remember, this is the best way to control your sugar and your baby's sugar. So make sure you follow your meal plan exactly. Your provider may also prescribe physical activity for you. Now, I know there are a lot of ideas about how and when you can exercise when you're pregnant, but think of this as a prescription from your doctor. She's looking out for your health and your baby's health, and she won't have you do anything that isn't safe. And keep in mind that physical activity will help your body use some of that blood sugar without needing any extra insulin. It will also probably help you manage your weight, which is important both during and after your pregnancy to avoid problems. So, if you haven't spoken to your doctor yet about exercise, bring it up with her. But do not start any kind of physical activity, even walking, without talking to her first. Now, not all women need medication for their gestational diabetes, but some do. If you do, your doctor will let you know. Insulin is the most common medication. As you may know, it needs to be given as a shot or injection. But don't worry, insulin shots are safe during pregnancy. And I know there are some concerns out there, but trust me, the needle will not hurt your baby. It's about the size of a dime, so it will not be able to get through all those layers of skin, muscle, placenta, and everything else your body has as protection. The insulin itself also won't hurt your baby. The placenta works to let your blood sugar in and keep the insulin out. In fact, if you need them, insulin shots will actually protect your baby by keeping your sugar levels in check. And sometimes other medications you swallow may be considered. But your doctor will talk to you about this if it's something she thinks may be right for you. Now, just like your baby, there's a chance that your sugar levels can get too low as well. And unlike high blood sugar, most people can feel when their sugar is low. Signs usually include shaking, sweating, and in extreme cases, passing out. The important thing to know about lows is they can only happen to women who are on medication for their gestational diabetes. So if you're controlling your sugar with diet and exercise, you don't need to worry about this. If you're on medication, it's a good idea to be prepared, just in case a low happens. Keep snacks in your purse, car, nightstand, and anywhere you might not have instant access to food. Your dietitian or doctor can give you ideas for snacks that fit into your meal plan. Now, there's one other test that your provider may ask you to do. Ketone testing. This test just helps her know if you're not eating enough and need more calories in your meal plan. If she asks you to do this, it'll be a simple urine test that you'll most likely do at home first thing in the morning. And depending on your ketone levels, your provider may just switch up what you're eating. Okay, now what about testing for your baby? There are at least 2 tests your doctor will probably have you do. The first is what's called a non-stress test. This is a really simple and painless test. She'll hook up a machine called an electronic fetal monitor to your belly. It shows her your baby's heart rate. Just like you, his heart rate goes up when he moves and down when he's resting. So that's what she'll look at. His movement and heart rate will show her everything is going well. The other test you'll probably have is an ultrasound. I know you've probably already had a few of these and know what they are. You may just have a few more to keep an eye on the baby's size and weight and the level of fluid in the womb. You may also have other tests, but your provider will let you know if she wants you to have them. Now, you may be wondering if any of this treatment will affect your delivery. Well, it might. If you follow the treatment and your sugar stays controlled, your baby will probably grow normally and stay below 9 pounds. If he is, you should be able to deliver vaginally and around your expected due date. If you don't treat your gestational diabetes, your baby will most likely get too big, and you may need a C-section and possibly an earlier delivery. So you can see why it's important to follow your provider's directions on diet, exercise, and medication exactly. I know that was a lot, so as a reminder, let's just go over everything we talked about here. Make sure you speak to your healthcare team on a regular basis. Ask them any questions you might have, and give them any information they ask for right away. Take your blood sugar readings at the same time every day. Your provider will let you know when that will be for you. And don't forget to record your sugar levels, food, and exercise in your journal. And make sure you follow your diet and exercise plan. Remember, when you're pregnant, it's not about eating more, it's about eating better. So now that you know what to do during pregnancy, let's move on to what to do after your baby is here. After your baby is born, there will be lots of excitement and lots to do. So make sure one of the first things you do is schedule a follow-up appointment with your doctor. Now, you'll be happy to hear gestational diabetes typically goes away after the baby is born, but your doctor will want to check your sugar levels about 6 to 12 weeks after your delivery to make sure you haven't developed type 2 diabetes or prediabetes. With prediabetes, your sugar levels are higher than normal, but not high enough to be called diabetes. It's kind of like a warning before type 2 diabetes. Just like gestational diabetes, it can cause insulin resistance and make your sugar levels go higher. And it also has no signs, so it's really important to follow up with your doctor and get tested. Otherwise, it could turn into type 2 diabetes. And as I've mentioned, diabetes is a serious condition with many long-term consequences, like vision problems or even death. But the good news is there are some things you can do to delay or prevent getting type 2 diabetes. Make sure you get your sugar levels tested on a regular basis. Your doctor will let you know what schedule is right for you. Take a look at your lifestyle with your doctor and see if there are any changes you can make. What you eat and how active you are play a big role. Of course, your doctor or dietitian can tell you what foods are best for you, but typically, eat more fruits and veggies and include more lean meats and low-fat dairy in your meals to help keep yourself healthy. And try to include at least 30 minutes of activity 5 days a week. This will also help with managing your weight, especially if you're overweight, which is something that can really lead to type 2 diabetes. Speaking of which, it's best if you can try to reach a healthy weight 6 to 12 months after delivery. That might seem overwhelming, but talk to your provider. She can give you guidance on what's best for you. Even something like breastfeeding may help both you and your baby manage a healthy weight. And if you're very overweight, even losing 10 to 15 pounds can make a real difference in your risk of type 2 diabetes. So really make sure you talk to your doctor about this. Also talk to her if you're planning on getting pregnant again. There's a 2 out of 3 chance that you'll get gestational diabetes with a future pregnancy. So she'll want to test you regularly and be involved, even before you get pregnant. Now, besides taking care of yourself, there are also things you can do for your child. As I mentioned before, if it's possible, breastfeed him. It may lower his risk for being very overweight. And let your child's doctor know that you had gestational diabetes. It will let her know to keep an eye out for any signs of diabetes, so she can treat it early. As he grows, help your child make healthy food choices. Kids learn by example, so show him healthy choices at home, eating out, in the grocery store, and wherever food is around. Also, help him to be active. He'll need at least 60 minutes a day. And again, talk to your doctor and your child's doctor about other things you can do to keep both of you healthy. Now, though no one would choose to have a pregnancy condition, there is an upside. First of all, gestational diabetes brings you something that a lot of women wish they had the money or time to do, have the opportunity to learn about nutrition through a guided diet plan. As an added bonus, they're usually able to manage their weight successfully, too. Once in a while, women even find they're thinner after having a baby than before they got pregnant. You also get an opportunity to learn about your chances for type 2 diabetes and how to delay or prevent it. It's sort of like getting a forecast of what could happen and getting the chance to correct the problems so it doesn't. Most importantly, of all the conditions you could get during pregnancy, gestational diabetes is one where you actually have an excellent chance at making a difference in your health and your baby's health. You control what you eat. You control how active you are. And you control your sugar levels.